There is a new surgical procedure that has only been performed in the United States since 1979. Concord ophthalmologist Dr. George Simon is one of the country's leading eye surgeons performing this technique. He is with us today. And one of the people who's benefited from his expertise is Henry Schneidman. Gentlemen, thank you both for being with us today. First of all, I tried to pronounce this earlier, and I think I got it right. What is it called again?
Radial keratotomy.
All right. Now, briefly describe for me. We've got a little videotape here we want to take a look at. Briefly describe for me what the surgery is.
Well, radial keratotomy changes the shape of the cornea from being steep, where the light doesn't focus on the retina, to being a little flatter, to where the light does focus on the retina and allows the person to see without glasses.
Is it a long procedure? Does it take a long period of time?
It takes anywhere from 5 to 15 minutes.
So it's very short, done under a local anesthetic?
It's done entirely under using just eye drops as an anesthetic.
What are we looking at right here? Is this the anesthetic? Can you see that?
Mm-hmm.
What are we looking at there, Doctor? Now,
there we're looking at an incision being made, one of the radial incisions being made with a diamond knife.
How many of those are made around around the lens?
Anywhere from 6 to 16, depending upon the severity of the myopia.
And in essence, you say it's flattening out the lens of the cornea.
It's flattening out the cornea itself.
All right, all right. Henry, you had this surgery done. First of all, tell me what your sight was like beforehand.
Beforehand, I couldn't see the wall to walk in here. It was basically 20/1200, 20/1000.
Now, earlier we mentioned pop bottle glasses, but this is those are the lenses that you wore beforehand.
They sure are.
Those are very thick, very, very thick lenses. You went in one day, had the surgery,
right?
Woke up the next morning. What was the difference?
Let's put it this way. I went out bicycle riding a day after surgery without glasses or contacts and could see the pebbles in the roads.
What was your vision beforehand, before this surgery? Most of us consider 20/20 vision to be normal.
As I said, it was roughly 20/1200.
20/1200, which is
off
real
the
bad.
Scale. Exactly.
Real bad. What is it now?
20/20, almost 20/15.
20/15. It's better than normal.
Absolutely.
Doctor, is this a surgery that is for everybody? 55 million people in this country who are nearsighted. Is this going to work for everybody?
Well, we have about 90% of those people who will be eligible for the surgery, or close to 85 or 90 million eyes that are eligible to have the surgery performed and have improved vision.
Now, this is not an inexpensive surgery.
Well, it depends on how you look at it. The surgery itself...
Let's look at it in terms of a pocketbook. How much does this cost?
Well, it's $1,400 per eye. And following, there are also some costs for the use of the hospital. And following the surgery, there's generally no need for glasses or contact lenses from that point on.
Wouldn't I be a little better off, at least as far as my pocketbook goes, just to go ahead and stick with the glasses or with the contacts?
Well, I think you have to look at it in terms other than pocketbook economics. You're talking about a change in someone's life, a change in someone's ability to see without corrective aids. It absolutely is miraculous to many of the patients who have the surgery to be able to, for the first time in their lives, experience what it's like to see themselves in a mirror standing 4 feet from the mirror without glasses or having to put contact lens in their eye. It's been a procedure that has changed the lives of many people in allowing them to enter vocations that they couldn't have entered previously because their vision didn't match up to the requirements of that vocation. Mm-hmm. For instance, flying, law enforcement, driving.
What's the best way for someone to tell if they're going to be, if they're a candidate for this sort of thing? I mean, I guess the most obvious thing is to contact their eye specialist.
That's correct. But most people who are able to wear soft contact lenses especially, and those people who know that they don't have too much astigmatism combined with their nearsightedness or myopia, are generally excellent candidates for the surgery.
Henry, when you had the surgery, you wore glasses beforehand. You see better now than when you had the glasses, you think?
Definitely, because you have a peripheral vision that you don't have with glasses. You know, George was saying before, this is what it's like from the patient's side. It's a dream come true because, you know, when you're a little kid and all of a sudden you're forced to wake up in the morning, put your glasses on, play sports in them, etc. And then, you know, here you've always say, if I could only not wear glasses, and now
was that important to you? You were willing to take some risk with this surgery.
Absolutely.
With any surgery, there is a risk.
There's always a risk, but I think if you have faith in your physician, your surgeon, you know, they're minimized. And I talked to other patients ahead of time, and so I knew how well they had done kind of beat the odds, so to speak.
Yeah, doctor, what are some of the risks involved with this?
Well, truthfully, there are very few risks involved in this surgery. Anesthetically, there are no risks whatsoever because the patient isn't being put under anesthesia. Surgically, the risks are absolutely minimal because measurements are taken prior to the surgery, and the cutting itself is done with preset instruments that have been determined by the measurements that were taken prior to the surgery. Following the surgery, patients can have some light sensitivity, they can have some variation in vision, and they can have something called glare, which is a star-like effect at night, which most people with contact lenses experience. However, these are transient in nature. They generally leave within a week to 3 weeks following the surgery, and the patient is then left just with good vision.
This is not an experimental surgery. This is something that's approved by the AMA.
Yes, this is no longer an experimental procedure now. This is being done throughout the United States. Originally, when it came to this country, there was a considerable amount of controversy over it based upon its having been initially performed in Russia. And the results in this country were not known. It was not known whether or not the results were going to be permanent or what the complications were, if any. Now, after the surgery having been performed in this country for greater than 5 years and a national study having taken place and which is still ongoing, it's been found that there are little to no complications.
All right. Well, doctor, thank you. Thank you, too, Henry. $1,400 an eye, it's still, I guess for some, it's still very worthwhile. And if you're interested in more on this and want to perhaps get in contact with the doctor, don't forget to call our TGI4 information line, 5618004. Thank you both.